health needs were already rising in kids well before COVID-19 made them worse. Dan Grossman shows us why rates of depression and anxiety have been going up and why the help has been lagging behind.
It's difficult to find a surface in this home that is not adorned with memories.
I think that's something that's at the heart and soul of our organization.
In total, there are more than 1,600 of these quilted patches, many of those pictured lost to suicide. Some are parents, some are sisters, some are brothers, but only one.
We're just going up one flight of stairs.
Was Jessica Mayo's husband.
This was the quilt that me and my children made to commemorate the loss of my husband at that time.
8 years ago, Jessica and her 2 kids lost their family's patriarch to suicide. At the time, her son and daughter were in middle school without anyone but her to lean on. A problem many kids who are dealing with grief and its effects find themselves in today.
I remember what that felt like for me, and I had a feeling of panic. Like, if I don't get my kids help right now, it felt like the most important thing, and I was incredibly focused on it.
Between 2016 and 2020, the number of children ages 3 to 17 diagnosed with anxiety grew by 29%, and the number of those diagnosed with depression rose by 27%. In just the last year of its study, the U.S. Department of Health and Human Services found those diagnoses led to a 21% increase in children with behavior or conduct problems.
It has been rising, and it's been rising pre-pandemic. And I also see it exacerbated by the pandemic.
Jennifer Leonardo is with the Education Development Center, a global nonprofit that works to improve education and health across the country. She says one of the big things that has led to these increases is the lack of healthcare access so many communities, particularly rural ones, face nationwide. According to the Brookings Institution, roughly half of the kids in the U.S. with a mental health disorder in 2019 did not receive treatment.
We need to train up more people. We need to also have skills developed for people who are not clinicians, more resources available through the schools, through community settings.
It brings us back here to Judy's House, a nonprofit Jessica first sought help from when her husband died, and then became the executive director of when she realized its benefit.
Kids are showing up at their doctor's appointments or in ERs presenting with mental health issues that should be addressed, or more routinely would be addressed if we had enough services available.
Judy's House works strictly through donations and fundraising, as it has hired a team of licensed mental health service providers who meet with families free of charge, hoping to remove some of the barriers that make access increasingly difficult. Since its inception in 2002, the nonprofit has helped more than 12,000 children and caregivers.
Looking for places where we can come together around shared problems to be addressed and solved is its own beacon of hope during this time.
Earlier in March, the Department of Health and Human Services announced nearly $35 million in funding opportunities for this very issue, hoping to slowly expand access to a need that has become increasingly urgent. I'm Dan Grossman.